Hi everyone, so welcome to another live segment for reading, and my name is Vandana PS, one of the reading trainers from Nidhu's Academy. Okay, so in this video we will be dealing with part A in detail, okay, and before that I'm so excited today. So do you have any idea? Okay, so naale namukku exam undalle, so for that I'm very excited and I know that you guys are also excited. So let me know in the comment box how many students are planning to attend the exam tomorrow. Okay, exam attend cheyna arengilu undo? Any students attending this live session are going to attend this exam tomorrow? Okay, all right. So ഒരുപാട് കുട്ടികൾ ചോദിക്കുന്നുണ്ട്. A lot of students are asking me regarding the offline classes, okay, that we have. So I have something to tell you about the offline classes. So if you have any doubts regarding this batches, okay, regarding the fees and everything, you can please contact the number mentioned on the screen, or else you can contact the number on the comment box. Okay, so we are starting the offline classes this month. Okay, yes, okay, so let me know in the comment box any students attending the exam tomorrow. Arengil attend cheyyunnando nalathe exam? Okay. Okay, so we have a new topic today. Okay, so I'm gonna detail about this topic. So that's here. The topic is here, which is hyperemesis gravidarum. Okay, so this is the topic. See, so how is the topic? Have you all done this material? Okay, so yes, good afternoon once again. Okay, hi Sobi, yes. Good afternoon, yes. Okay, so about this material, so before going to the material, so we have a revision today, okay, because naale namukku exam aanu, so let's revise about everything about part A today. Okay, so yes, it was very easy. Yes, it was very easy for you. Yeah, this material is very easy. Okay, I know that. Okay, so anyway, so about part A. So yes, what do you know about part A? നിങ്ങൾക്ക് എന്തറിയാം പാർട്ടിനെ പറ്റി? What do you guys know about part A? Okay, hi Sharmila, good afternoon dear. Yes, okay, how are you? Okay, so that's that. So about the material and part A, to complete part A, okay, we have 15 minutes. നമുക്കറിയാം this exam is 1 hour exam അല്ലേ? നാളെ അറ്റൻഡ് ചെയ്യാൻ പോകുന്ന exam 1 hour exam ആണ്. So to complete part A, that is the first part. So we have 3 different parts in this exam. Okay, so what are they? Part A, part B and part C. Okay, and for the completion of part A, we can take, or you should, okay, not we can, yeah, you should take 15 minutes, not more than that. Okay, so for the rest of the time, that's 45 minutes for doing part B and C. Okay, and in this 45 minutes for part B, it's maximum 10 to 12 minutes you can take, and the remaining time, which is 33 minutes for part C. Okay, so that's all about that. Then, so this is one of the major parts that we are going to deal. So part A. Okay, yes, Reenu, Kavita, Anita, hi Anita. Okay, yes, Kavita and Reenu, good afternoon. Okay, so what about part A? How many questions? Etra questions undav? So in part A, the time is 15 minutes and the number of questions will be 20. Okay, in part A we have 20 questions. Okay, this 20 questions they have categorized into 3 different sections. Okay, so the first one, which is 1 to 7 set of questions, that can be called match the following. Okay, so match the following, which means what? So you can read the question 1 to 7, then underline the keywords from the question. Okay, question vaikya, keywords underline here. So please do underline the keywords from the question, and maximum it is 3, not more than that. Okay, then you can locate your answer from the text. Okay, so part A is going to check whether you guys are able to locate your answers. നിങ്ങൾ ആൻസർ ലൊക്കേറ്റ് ചെയ്യാൻ ഏബിൾ ആണോ എന്നാണ് അവർ സെർച്ച് ചെയ്യുന്നത്. ഓക്കെ, അവർ നോക്കുന്നത്. So please locate your answers from these text. Okay, so for that we have 4 different texts in part A. Okay, text A, text B, text C and text D, and each of the texts will be different from one another. Okay, and one of the texts will be a pictorial of something. ചിലപ്പം എന്താ പറയുക, ഒരു ടേബിൾ ആയിരിക്കാം maybe, or a flow chart will be there, or a diagram will be there. So whatever it is, one of the texts will be a pictorial. And in this particular material, in text B, see, there is a table. Okay, yeah, we have a diagram, I mean a pictorial here. Okay, so likewise one of the texts will be a pictorial. Okay, yes. Yes, Renu, we have 20 questions in part A. Yes, 1 to 7 match the following, and yeah, 8 to 14 it's short answer questions, and 15 to 20 fill in the blanks. Okay, then coming back to the first set of questions. So I've told you regarding underlining the keywords. So why we are underlining the keywords from the question? It's a common doubt, right? എന്തിനാണ് ഇങ്ങനെ underline ചെയ്യുന്നത്? Because these keywords are going to help you to find out your answer. I mean, yeah, locate your answer. Okay. So for that, please do underline maximum 3 keywords, not more than that. As well as when you underline keywords, it should be 3 individual words, not a group of words, okay? Or a group of words നമ്മൾ underline ചെയ്യരുത്, it should be 3 different or 3 individual words. Okay, so that's all about underlining the keywords. Then, and identify from which text you got that answer. You don't have to write that exact answer there, but still just write from which text you got that answer, okay? That's enough. For example, if the first question that's from text A, you can write there what? You can write there A. Don't write text A, just write A. Okay, that's enough. And then the next set of questions, which is 8 to 14, that can be called what? It's called short answer questions. Okay, so what do you mean by short answer questions? And there are chances, there are possibilities to make a lot of mistakes in this particular area. Okay, ഒത്തിരി mistakes വരാൻ chance ഉള്ള ഒരു area ആണ്, that is 8 to 14 set of questions, and mark പോകുന്നതും in this particular area. Okay, so why? Because see, they need just answer to the question. Okay, question answer മാത്രം മതി, don't write anything additional there. Okay, just answer to the questions. Hi Laisamma, good evening dear. Yes, okay, yes, good afternoon. Okay, so what about that one? Okay, answer to the question, which means, for example, I'll give you an example. Maybe if the question is like, when it is introduced. Okay, the question is starting with when it is introduced. Okay, and the answer from the paragraph is, it was introduced in 1948. Okay, so that is mentioned in the paragraph. Answer is, it was introduced in 1948. So what was the question? Question എന്തായിരുന്നു? When it was introduced. Okay, so what will be your answer? Let me know in the comment box. എന്തായിരിക്കും നിങ്ങൾ ആൻസർ ചെയ്ത? That is a short answer question. So once again I'll repeat. Question is when it was introduced. Okay, and in the answer, I mean in the paragraph they have mentioned, it was introduced in 1948. So what will be your answer? What will be your answer? Hi Reshma. Yes. Okay Reshma, any idea what will be your answer for that question? Let me know in the comment box what will be your answer for that particular question, when it was introduced. Okay, okay Reshma, okay Laizamma, okay Bhumida. Okay, any other answers? Okay, so I'm repeating the question once again for all the students. Question is when it was introduced. Okay, and in the paragraph it is mentioned it was introduced in 1948. It was introduced in 1948. So what is your answer, or what will be your answer for that? Okay Maria. Okay, so Reshma is saying it is in 1948, and Laisamma, Bhumida, Maria saying it is 1948. So which one is correct? In 1948 or just 1948? ഏതാണ് correct? In 1948 or just 1948? Yes, okay Renu, in 1948, yes, that is the correct answer, in 1948. So why? And that's called short answer question, because question is asking you regarding yeah, sorry, question is asking you regarding when it was introduced. Okay, because they need the time, എപ്പോഴാണെന്നാണ്. Okay, when they need the time, so that means in 1948. Okay, so answer should be in 1948. If the question is in which year it was introduced, ഏത് വർഷത്തിലാണെന്നാണ് ചോദിക്കുന്നതെങ്കിൽ you can write 1948 there. That is correct. Okay, so understand the difference. Okay, so the first question was when it was introduced, so in 1948 is the answer. Second question, in which year it was introduced, then the answer is 1948. Okay, so that is the difference. Clear? Okay. And I will give you another question. How many students are attending the program? So that is the question for example. Okay, how many students are attending the program? എത്ര കുട്ടികളാണ് attend ചെയ്യുന്നത്? Okay, so it is mentioned in the paragraph like more than 64 students are attending that program. So what will be your answer? Okay, so more than 64 students are attending the program. So what will be your answer? Let me know in the comment box. Yes, so B, it is 1948. Yes, dear. Yes, dear. It's the correct answer. Yes. So what about this question? Question is, how many students are attending the program? And it is mentioned in the paragraph like more than 64 students are attending the program. So what will be your answer for that? In area, what will be the answer? Okay. Please comment. Let me check your answers whether it is correct or not. Okay, Renu, 64. Okay. Any other answers? More than 64. Okay, so be more than 64. Okay. Any other answers? Okay, Priya Delta, it's more than 64. Okay. Okay. Yes. So I'm coming to this answer. It's 64. Okay. Again, that's called short answer questions. Answer to the question. Okay, how many students? That is their question. Etra kuttigal. So etra which means what? They need the number, just the number. So that means 64. Okay, so there is no need to write more than 64. It is 64. Clear? So that is all about short answer questions. Then another important instructions that I want to give you is that you don't have to repeat the words from the question into the answer option. Ningal same words answer like repeat in the karilla. Okay, so for example, I'll give you another question. Okay, so the question is that what neuropathy or which neuropathy is mentioned in the paragraph regarding the procedure or regarding the condition. Okay, and it is mentioned in the paragraph the procedure which is called or the condition that can be connected with mononeuropathy. Okay, so that is in the paragraph. So what will be your answer for that? Which neuropathy? That is the question. Okay, so what will be your answer? എന്തായിരിക്കും നിങ്ങളുടെ ആൻസർ? An idea. Question is, which neuropathy is associated with the condition? And the answer is, yeah, I mean in the paragraph it is mentioned like mononeuropathy is associated with the condition. So what will be your answer? Mononeuropathy, not modern. Okay, sorry, it's mononeuropathy. Mononeuropathy. Neuropathy is in the question and in the paragraph mononeuropathy is associated with the condition. So what will be the answer? Mononeuropathy. Okay, so be mono. Okay, Bhumida, mono. Okay. Okay, Nijida, mono. Okay. Any other answers? Okay, Kavita, it's mono. Okay. Yes, Renu, mono. Okay. Any other answers? Priya, okay, mono. Okay. Answer will be mononeuropathy. Okay. So, why? Okay. And just I've told you regarding you don't have to repeat any single word from the question into your answer. But if it is a name, you can repeat. Adoru പേരാണെങ്കിൽ നിങ്ങൾക്ക് അത് repeat ചെയ്യണം. You should repeat it. Okay, so mononeuropathy is actually a name. Mononeuropathy, it is a noun. Okay, it's a name, it's a noun of the procedure. So when you write that answer, which neuropathy, answer should be mononeuropathy because it is not a separated word. Okay, for example, mononeuropathy, it's like yeah, see, like this, there is no space in between. Okay, if it is separated with a space, then you can write mono there because neuropathy is another word. It is separated. Okay, if it is not separated, if it is a single word, then write that full name there, mononeuropathy, because names can't be separated. Namukku names separate cheyan pattilla. Okay, so in such cases you can repeat the words. Okay, otherwise in any other situations you don't have to repeat any single word from the question into the answer option. Okay, and one more exception is there. Okay, so what is that? Any idea? One more exception is there. In this case also you can repeat the same. That case lana. First one in the case of names or nouns, and what about the next one? Or case repeat. Yeah, in which case? Any idea? In which case or in what case you can repeat the same word or that same thing into your answer option? Okay, and you can't. Okay, you can't repeat the same word from the question into the answer options in any other occasions. So only in these two exceptional cases you can repeat the same. Repeat what it is already I've mentioned about that. In the case of names, you can repeat names. And the second thing is that in the case of percentages. Okay, percentage. For example, in the question they are asking you, what percentage of women are suffering from this condition called COVID-19. Okay, and the paragraph it is mentioned 65% of the women are suffering from the condition. Okay, so what will be your answer for that question? What will be your answer for that question? Any idea? Okay, disease conditions, which means yes dear, yes Reshma, that's called names. If it is names, you can repeat the names. Yeah. Okay, and this is the second situation in case of percentage. Okay. Yeah. So what will be the answer for that? Question is asking you what percentage of women are suffering from COVID-19, and in the paragraph it is mentioned 65% of women are suffering from the condition. So what will be the correct answer there? Yes. Okay, Reshma. Yes, Gina. Yes, Clint. Okay, Benny. Yes, Sobi. Answer will be 65%. That percentage symbol should be there. Okay, so when you write that, just write it as 65%. Okay, that sign should be there or the symbol should be there. Okay, so in that occasion also, in that situation also, you can repeat the same. Understood? So that's all about that. And we are moving to 15 to 20 set of questions. So that can be called fill in the blanks. So what do you mean by fill in the blanks? Okay, so read the question, do the same. Underline the keyword from the question and find out which word is missing from the sentence. Either word is missing either words are missing and just write that particular word or words there. That's enough. Okay. And the major thing is that they will not give you the direct exact same line from the paragraph into the question. A same line okay, so instead of that it will be, part A is all about a play with synonyms. Okay, so what do you mean by synonym? Synonym, which means same meaning will be there but entirely different words. Okay, words will be different but same meaning. Okay. Yes, Reshma, yes, you can fill that particular gap there, yes, that blanks there. Okay, that's all about fill in the blanks. And I have no idea whether you have noticed this instruction here. Okay, you can write it in a word or a short phrase. Or a word or a short phrase answer. Okay, so word is a word. Word itself is a word. Okay, so what do you mean by short phrase? This is a very serious issue because short phrase majority of the students are writing it in 4 or 5 words. So that is not an acceptable situation. Okay, and acceptable answer. Yeah. So for that you can write maximum 3 words, not more than 3 words. Okay, phrase what is a phrase? Phrase which means combination of words. Okay, short phrase which means maximum 3, not more than 3. Clear? I hope it is clear. Then we are just moving to the main point, that is the strategy. Okay, so what strategy we are using? So I started from the time. So once again I am repeating for the students. Okay, first one 15-minute exam, part A. Okay, total exam it is 1 hour exam, and for part A you have 15 minutes, 1-5. Then how many questions? 20 questions will be there. So what are the categories of questions? Match the following, short answer, fill in the blanks. Okay. Then next one, what strategy we are using, and I have told you regarding what are the different type of text. Text different text, 4 text will be there. Okay. And what strategy? To complete these all 20 questions, we need a strategy. A method. So what is the method we are using here? Okay, so what method we are using here? Yes, Reshma, maximum 2 or maximum 3 words. Yes, dear, correct here. Maximum 3, not more than that. Yeah. Okay, so what method we are using here? In the method we are using skimming and scanning. You guys know about it, very thorough about that, skimming and scanning. So what is skimming and scanning? Okay, for the students who are going to attend the exam tomorrow, I am just giving you a friendly advice. Please do skim and scan. Okay, skimming, which means fast reading, which means speed reading, and scanning. Scanning, which means what? We are searching for important words from the text. Okay. So let's see what is skimming and scanning. So skimming and speed reading. So when you speed read, underline the keywords. Okay. So in what pattern or in what idea, in what notion you can underline the keywords. Keywords underline I'll show you. Okay. So this is the topic. It is hyperemesis gravidarium. Okay. So yes, text A, very small text, and the questions are also very easy. Okay. Yes, okay Renu, it is quick reading. Yes, Reshma, quick reading, and we are searching for the words. Okay, so tell me, please comment it here, because I just want to know how many of you know about this keywords. Keywords keywords mark. So please do comment it here. Let me know about that. Okay. So yes, so what are the keywords from text A? I'll read text A. Then please do tell me what are the keywords from text A. Text A ningal vaaichittu endokku keywords aanu ningalku manasilayana, please let me know in the comment box. Okay. So hyperemesis gravidarium is when extreme persistent nausea and vomiting occur during your pregnancy. It can lead to weight loss and dehydration. Hyperemesis gravidarium is sometimes called severe morning sickness. Experts don't know for sure what causes hyperemesis gravidarium. However, rising hormone levels are most likely what causes it. Specifically, HCG, human chorionic gonadotrophin, which your body makes during pregnancy very quickly and in large amounts. HCG levels peak around 10 weeks of pregnancy, which is when most people report having the more severe symptoms. Estrogen, another hormone that increases during pregnancy, may also play a role in causing nausea and vomiting. Okay, HG is uncommon. It affects less than 3% of pregnant people. Okay, so from text A, what are your keywords? Let me know what are the keywords from text A. Hi Riga, Mary, Raphael. Okay. Yes, Balu, extreme. Okay, I'm just marking the word extreme. Okay, any other words? Okay, weight loss, severe morning sickness, extreme persistent nausea, vomiting, pregnancy, weight loss, okay, HCG, okay, hormone level 3%, okay, so 3%, okay, then, okay, hormone levels, estrogen, okay, so where is estrogen mentioned? Causes, okay, you can also mark this term hyperemesis gravidarium or from here also, yeah, once it's fine. Also the number 10 weeks, okay, the abbreviation, yeah, okay, again the number. Anything else? Anything else from the first para, I mean from the first text, let me know. Okay Lisa, 10 weeks, okay, okay, so that's all about text A. See, when you mark keywords, how will you know that these are the keywords? These important words, okay, so for that I'll give you some details about the keywords, okay, and you can mark all the headings. So there is no heading mentioned here, so no need to mark anything. Subheading. Any subheadings mentioned? No subheadings mentioned. Okay, then all the numbers. Okay, so what are the numbers mentioned here? In the first line there is no number, second sentence there is no numbers, third, yeah, no, fourth there is no, but in the next line there is a number 10. Okay, 10. And what about any other numbers? 3%. Okay, so that's all about marking the numbers. Then next one, signs and symbols. So what are the signs and symbols mentioned here? Only one sign is here, that is percentage. Okay, then all the names. So what are the names mentioned? The name of the disease condition. Okay, so name of the disease condition. Then any other names mentioned here? Again the name is repeated. You don't have to mark the same thing, okay, just mark once. And so that I'm just removing, I'm rubbing. Okay, yeah, the word from here. Yes. Okay, then any other names mentioned? Any other names mentioned? No other names mentioned. Okay. Yes, estrogen is already there. Yeah. So these are the names mentioned. And what about the next one? It's all about abbreviation. So what are the abbreviations mentioned? Endaka short forms aanu koduthikunnu. HG. Okay, HCG. So these are the short forms mentioned here. Okay, that is repetition, so you don't have to mark it. Yeah, still. Okay, then what about next one? All the brackets. So one bracket is here, another bracket is this. Any other brackets mentioned? No other brackets mentioned. Okay, and what about the next one? Italicized or bold words. No italicized or bold words here. Okay, and what about ninth one? The words which indicate time. Samayam kanikkunna endengilum words undo nokka. So I am marking the words that indicate time. Okay. So what are the words that indicate time? See, during is a word that indicate time. Okay. Actually, estrogen spelling mistake, actually according to American English it is different, UK English it is different. Okay, so that's the difference maybe. Yeah. Okay. Anything else? During? Yeah. Any other time? Any mentioning about time? Time in indicating words. During, when. Okay, so these are the words that indicate time. Okay, and what about the next one? So abbreviations, then brackets, all the italicized and bold words, then the words that indicate time, then words indicate experiment related words. Any experiment related words here? Have you seen any experiment related words? Any idea? Let me know in the comment box any experiment related words in this text, first text. Okay, like diagnosis, identification, administration, observation, absorption, any those kind of words? Okay, so there are no words that indicate experiment here. And what about the words that indicate research related word? Okay, uncommon, affects, okay, research related words. Okay, uncommon, affects. And as well as any other words? Experts, actually you can connect with, there is no connection about, research, but still if you want you can, word, name item connect him, healthcare provider, doctor, so likewise experts. Okay, yeah, fine. Okay, then any other words related with research? No other words. Okay, and the next one, then just give a special attention towards the first and last line of each and every paragraph. So what is the first line here? Hyperemesis gravidarum is when extreme persistent nausea and vomiting occur during your pregnancy. And what about the last line? This is a very small text, so I am just reading the last line here. HG is uncommon, it affects less than 3% of pregnant people. Okay, and the final one, all the bullet points. No bullet points here. So this is how we are marking keywords from the text. Okay, so likewise I am underlining keywords from text B. So first of all this heading. Okay, again the numbers. Okay, then any other names. Okay, brackets. Okay, and I am marking all these words. Okay, important underlined sentences or anything. Yeah, so these are the words, I mean my keywords from text B. And I am moving to text C, underlining the heading, then all the brackets and abbreviations, okay, and the words indicate time and other names, okay, see name of a country, then research related words, okay. So these are my keywords from text C. And what about text D? It's all about the management. Again, title is here, lifestyle changes, dietary changes. So this is like bullet points, not even in bullet points, but still these are points. Then anti-nausea medication, total parenteral intravenous nutrition or TPN. Okay, so I'm just marking all the abbreviations and the brackets. Okay, so that's all about that. Yeah, so that's all about my keywords from all these texts. That's enough. Okay, name of the medicines as well. Okay, yes, so that's that. Okay, so any other keywords? So what are your keywords? Okay, so same keywords like what I've marked here. Okay, so now we can move to the first question. Okay, now question answer. So the first question, how do racial factors are linked to hyperemesis gravidarum? Okay, so my keywords, racial, linked, factors. Yeah, so these are my keywords from the first question. Any idea? Clinical experiment words, okay dear? Okay, yes Rika? Any idea what is the correct answer for the first question? How do racial factors? What is the correct answer here? Okay, so I am moving to the answer. So my answer is C. Okay, how do racial factors? So I got the answer from here, text C. See this particular line. Other factors described for hyperemesis gravidarum include young age, black or Asian ethnicity. So that means the racial factors. Okay, so that's from text C. Okay, yes, Laisama and Reshma, it is from text C. Very good, yes. Second question, what causes hyperemesis gravidarum? So my keywords, causes. Okay, causes. So where they have mentioned about the causes? So my answer is from text A. Okay, so because in text A very clearly they have mentioned about the causes. See the second sentence, second paragraph. Experts don't know for sure what causes hyperemesis gravidarum. However, rising hormone levels are most likely what causes it. Okay, so answer is from text A. Yes, Kavita and Laisama, it's from text A. And third one, what is the preponderance of hyperemesis gravidarum? So my keywords, preponderance, which means that prevalence. Okay, prevalence or spreadness of the condition, common. Okay. Okay, so B, second question is from text A. Very good. Okay, so what about third one? Preponderance of hyperemesis gravidarum. So again, that answer is from text A, because preponderance or the spreadness which is mentioned in text A, the last line, it affects less than 3% pregnant people. Okay, so that's from text A. So answer is A. Okay, yes, so B, it's from text A. Third question, yes, Kavita, text A. Very good. Fourth one, how do we manage the severe cases of hyperemesis gravidarum? So the keywords, manage severe cases. Any idea? Management. Okay, so that's from text D, because management is mentioned in text D. So this is how we are locating the answers. Okay, see, this is how we are locating the answers. And okay, then what about fifth question? Kind of metabolic imbalances develop in women due to hyperemesis gravidarum. So my keywords, metabolic imbalances, and in women. Okay, so any idea? Fifth one. Okay, so B, fourth one is from text D, yes, management. What about fifth one? What kind of metabolic imbalances develop in women due to the condition? Okay, so metabolic imbalances it is mentioned in this particular box. Okay, metabolic imbalances. Okay, so that's from text B. So answer is B. Yes, very good, Lazama. It's from text B. Then sixth one, what food items shall be avoided to prevent hyperemesis gravidarum? So my keywords, food items avoided. So these are my keywords. Okay, and management is connected with avoidance of food items, right? So that's from here. So what kind of food items? Your provider may recommend avoiding greasy or spicy foods. Okay, oily foods or spicy foods. So that means it's from text D. Okay, seventh one, which are common risk factors of the condition? So common risk factors. So what about risk factors mentioned? Okay, so what are the common risk factors? So risk factors mentioned in text C. So these are the risk factors mentioned. Okay, so answer is from C. Clear? So these are the answers. Okay, Lisa, yes, it's from text C. Very good, dear. Okay. Yes, OB, it is from text C. Okay. So that's all about 1 to 7 set of questions. Now 8 to 14. Okay. So short answer questions. So the first question, the category of drug to which medication like diphenhydramine is classified. Okay, or diphenhydramine is classified. So category, then medication, then diphenhydramine. Okay. So what category? Okay, very good, Lisa and Kavita, 7 out of 7. Okay, very good. And what about 8th one? Which category? What category of medicine is that? Category of medicine, drug, medication like diphenhydramine. Okay, so a lot of medicines mentioned in text D and I found it here. See, already I have marked this particular medicine name, and your provider may suggest an antihistamine like this medicine. Okay, so answer is antihistamine from text D, antihistamine. Okay, then the next question, the elevation which means what? Increase of which hormone during pregnancy is responsible for the onset of almost all symptoms. So these are my keywords. Okay, elevation, hormone, almost. Okay, so hormones mentioned in text A, right? Okay, so in text A they have mentioned about hormones. So what are the hormones mentioned here? HCG as well as estrogen. Okay, HCG is one of the hormone as well as estrogen is another hormone. So what is the correct answer, whether it is HCG or estrogen? Okay, yes Reshma, it is HCG. Okay, answer is HCG. See, HCG levels peak elevated around 10 weeks of pregnancy, which is when most people report having most severe symptoms, so almost all. Okay, so that is HCG. Answer is HCG. Okay, Lesima, it is HCG. And the next question, 10th one, alternative designation for the condition. So alternative designation, which means name. Okay, so what is another name for this condition? That's from text A. Okay, so answer is severe morning sickness. Okay, yes. Hi Yogeshwari, how are you? Okay, so that is severe morning sickness. Okay. Yes, Sobi. Yes, Reshma. Okay. Okay, then what about the next one? 11th one. The wearing of which device is recommended by the provider to mitigate, avoid nausea? Wearing, device, provider. Okay, so what device is mentioned? Okay, so the device is mentioned in text D in management. See the first line. Okay, these changes might include wearing a pressure point wristband. Okay, so whether you can write this or you can write acupressure bands, both are correct. Okay, you can write this one or this one, so both are correct. Okay, pressure point wristband or acupressure bands. Okay, so that is the correct answer. Okay, hi Binsi, how are you? Okay, yes. So, okay, Riga, it is acupressure bands or yes, it is pressure point wristband. Okay. Then next one is, what are the possible outcomes of dehydration? So, possible outcomes dehydration. Okay, so what are the possible outcomes of dehydration? 12th one. So, that is possible outcomes, maybe it is in signs and symptoms, right? So, the possible outcomes which are dehydration causing ketosis and constipation. So, answer is ketosis and constipation. So, these are the correct answers. Okay, very direct answer. And what about the next one? What condition is characterized by abnormal cell growth in your uterus? So, condition abnormal, then uterus. Okay, so what is the correct answer there? What condition is characterized? Maybe it is in risk factors. Okay, the conditions, the risk factors. So, what condition is mentioned here? Having gestational trophoblastic disease or GTD. Okay, which involves abnormal cell growth in your uterus. So, answer is either you can write GTD or you can write gestational trophoblastic disease. Both are correct. Okay. Then next one, 14th one. What percentage of pre-pregnancy body weight might get deducted due to HG during pregnancy? So, these are my keywords. Percentage deducted HG. Okay, so what is the correct answer here? It is 5%. Okay, so answer is 5% from text B. So, where is it mentioned? See, loss of 5%. So, what percent? 5%. Okay, answer is 5% and that is the correct answer. Okay, then the next one. So, that is the end of short answer question and we have fill in the blanks here. So, first one, dash is another hormone that increases during pregnancy that also plays a role in causing nausea and vomiting. So, what is another hormone? Okay, so hormone's name is mentioned in text A. Okay, so that hormone is estrogen. Okay, during pregnancy they also play role in nausea and vomiting. So, estrogen is the answer. Yes, okay, Lazima, estrogen should be the answer. Very good, dear. Yes, okay. Okay, sorry Reshma, it's not HCG, dear, it is estrogen. Okay, Renu, it is estrogen. Hi Aruna, good afternoon, dear. Okay, then 16th one, HCG levels that peak around dash of pregnancy, which is when most people report having the most severe symptoms. Okay, so what about that one? Any idea? Yes. 16th one, HCG levels that peak around dash. Okay, so that is yes, 10 weeks, right? 10 weeks. Okay, so answer is from again text A, same paragraph. Yes, so peak around 10 weeks of pregnancy, that is the missing word. Okay, 10 weeks of pregnancy, 10 weeks. Then the next one, 17th one, the most severe cases of hyperemesis gravidarum might require that nutrients be given through IV that bypasses your dash completely. So, what completely? Okay, so which is from text D. Okay, so what completely? See, the last one. Okay, so hyperemesis gravidarum might require that nutrients be given through an IV that bypasses your digestive system completely. So, answer is digestive system. So, this is how they will ask you. Okay, so we need to write which word or which words are missing. Okay, yes, Yogeshwari, it is digestive system, dear. Okay, Riga, correct answer. Yes, Kavita, Lesima, Sobi, it is correct. Very good. Yes. And what about 18th one? Other factors described for hyperemesis gravidarum include dash, black or Asian ethnicity. So, what is the correct answer there? So, these are the other factors. Okay, so answer is from text C. Okay, risk factors. So, young age, very direct answer. Young age, black or Asian ethnicity. So, young age is the correct answer. Okay, young age. Then 19th one, studies show foods high in dash can contribute to nausea during pregnancy? Okay, so foods high in dash, high in what? Okay, so that's from text D. Okay, so foods high in what? Where is it mentioned? Okay, so where they've mentioned about that? Yes, Vibina, it is young age. Okay, Renu. Yes, Yogeshwari, it's not age, dear. Reshma, it is young age. Okay, okay, dear, it's young age. Okay, so that is from text D. Dietary changes. Small frequent meals of bland, dry food can help with nausea and vomiting. Crackers, toast, white potatoes or rice are good examples. Studies show foods high in fats can contribute to nausea during pregnancy. So, answer is fats. Okay, answer is fat from text D. And what about the last one? Women would be having dash such as metabolic ketoacidosis or thyrotoxicosis. Okay, so metabolic ketoacidosis, yeah. So, what is the correct answer there? 20th one. Answer is, it's from text B, so that is metabolic imbalances. Okay, again direct answer, metabolic imbalances should be the correct answer. Okay, so that's all about that. Okay, so I'm going to wind up the session. Okay, so all the students, those who are going to attend the exam tomorrow, all the very best. Okay, so please do attend the exam very carefully. Okay, so do your best, forget the rest. Okay, so thank you so much. Take care. Bye.